Hello, everyone. Welcome to the World Health Network broadcast. My name is Ben Calderwood. We're really happy to share another business spotlight with you today, a conversation with Aera Barnette. Aera runs a wellness coaching and massage therapy practice called Bodywork with Aera for people living with chronic pain in Seattle, Washington. So welcome to the broadcast, Aera. We're really happy you're here. Uh,
Yeah, thanks. I'm happy to be here too.
Please, so go ahead and introduce yourself. Tell us a little bit more about yourself and your background, and of course, your business, and describe the COVID mitigations that you have in place at your practice.
Sure. So as stated, I'm Aera Barnette. I'm a licensed massage therapist in the state of Washington. In my clinic, uh, the COVID Safe Community Action Group that I'm a part of generously just recently donated some more air purifiers to me because I moved into a larger space. I have had to adapt my COVID precautions as the pandemic has shifted and changed or evolved over the years. And one of the things is that it's imperative that not only do we maintain wearing KN95 or higher quality masks, but that we also have this WHO standard level of air filtration on at all times when we are in session together. I'm also an intraoral certified therapist, and so that requires that the patient, if they need that, that they don't wear a mask. So in that case, I administer a COVID test. So I have those
Oh,
available for people. So we do testing. We have KN95 or above masks. We have WHO standard level of air filtration. I disinfect with um, accelerated hydrogen peroxide wipes, which are absolutely effective at killing pretty much anything within like a minute. One of my sticking points of being a massage therapist and having worked in so many different establishments is that you would be surprised how many medical massage practices are not cleaning effectively and they're using cleaners that have very specific instructions. They're not being used properly.
mhm.
Uh, And so, one of the things that I made sure that I did in my own practice is that cleaning, sanitation, and air filtration are at the highest standards that I can muster with my situation.
That's fantastic. That is really a comprehensive top to bottom list of COVID precautions. That's really nice to hear. Talk a bit more about, I guess, the impact that your business, that this COVID safe space you have created for your clients, um, and these truly comprehensive COVID precautions that you're taking have had on your clients, on your client base, and your clients' health.
Yeah, so a lot of people who are still practicing mitigation measures are rightfully so nervous to go and get medical care. And that includes massage therapy. Especially massage therapy, I think, is unique in that you spend way more time with your patients than a doctor does.
Hmm.
And while I don't have a crowded waiting room for people to have to navigate or anything, it can feel intimidating for community members to go and lay on a massage table and feel safe, knowing is the therapist going to keep their mask on? Are they going to wear the appropriate level of mask? So I think being really transparent about these protocols and making sure that people understand what the expectations are, I think that has a positive impact on the community. I think it helps members of the community feel safe and feel like there's an option to get the benefits of massage therapy, which also some of the benefits of massage therapy are to help with loneliness and isolation. And a lot of us are still isolating, barely go out or hang out with people just because there's so few of us that are practicing um, COVID precautions in our day-to-day lives.
Yeah. What's the best way for people to find you, find your practice, and maybe ask any questions that they may have about your precautions and the services that you offer?
Yeah, so I have a website. It's bodyworkwithaera.com. And there is a contact form on my website where people can inquire about booking an appointment or to send questions that they may have. And then I'll be able to respond via email to that. Also have a Facebook page and an Instagram. And I do have a YouTube with some videos of my work. I hope to add more to that later. But what's most important right now is that I meet the people who need the services I offer and that I can assure them that I can provide what they're looking for in a safe environment.
That's fantastic. Uh, this has been a really great conversation. We've been chatting today with Aera Barnette from Bodywork with Aera in the Queen Anne neighborhood of Seattle, Washington. I thank you again for sharing your experience running for practice, for the very high levels of COVID precautions you maintain, and uh, how to describe it. I think for really committing to an act of community care, which is crucially important at any time, but perhaps as we enter the fifth year of a pandemic, even that much more important even now. Before we go, anything else you'd like to add about yourself or the work that you do?
Yeah, so I'm really happy to be here for the community. I feel very strongly about supporting economic endeavors and community endeavors that are creating accessible spaces for us. Accessibility is extremely important to me. I have accessibility points on my website where I detail out the different ways to get to the building and like what you can expect and what my
Right.
skill levels are, those kinds of things. Because when you're working with so many people with different disabilities, you have to make sure that they understand and can give informed consent to what they're getting themselves into. And my industry is still struggling to do these things that support disability justice. And so I wanted to model what we could be doing better. And so that is reflective on my website.
Thanks again for this conversation. You can find Aera and their practice at bodyworkwithera.com. And you can learn more about the World Health Network at whn.global. We're a global community working to end the pandemic as a global health threat. We hope you'll visit the website and consider joining us. Thank you so much. We'll see you in the next broadcast.